Welcome to another episode of the Heart of Healthcare podcast. My name is Margaret Izini, and I'm with.
Yours faithfully.
Dr. Bondip, say your
Oh,
name.
thank God you know my name.
Oh my goodness. But I mean, the other people too who are listening, especially our listeners, they need to know your name.
Hello, listeners. My name is Von Deep.
Thank you.
Thank you too.
So, sir, today there's an interesting topic we're going to be handling, and is on healthcare. If healthcare is a ministry or is a marketplace. So what's your take on that? I think what I'm thinking is if it's for profits, when they say marketplace, if it's for profits, of course I don't know what's coming to your mind, but there are different things that come to people's mind when they hear a ministry or marketplace. Sometimes we call the ministry a marketplace, yeah.
Mm-hmm.
But then this time around they said, is it a ministry or a marketplace? So I'm feeling that marketplace in quotes is for profits.
I don't know why you are feeling on their behalf. Yeah, because whosoever asks that question, you can feel for the person. Yeah. I think to start with, that's a false dichotomy. There are not two options here. It's not an either-or situation. You can't say, is it a ministry or marketplace? Why can't it be both?
Because, looking at it, I think that sometimes we tend to think it's just a marketplace. Or we think it's a ministry. There are extremes to this.
Okay. So, not to sound technical, before you call me medical elder, I'm not a medical elder.
You're a medical elder.
So,
anyway.
when you talk about marketplace, really, what do you mean? Because marketplace for me is a place where people interact. You do buying, you do selling, you do trading, you exchange something of value.
Mm-hmm.
Yeah, so either you exchange it with monetary value. Before trade was by barter, but that was still marketplace. So you do this favor, you give me this, I exchange it with something. That's what makes it a marketplace. Yeah, so I think looking at healthcare as being for profit making alone to only qualify that as a market, I think that's an extreme way to look at it. Some other things happen in markets. People meet, people interact, people exchange values. Yeah, so if you look at it in that context, I think it's safe to say that there is a third option.
Okay.
Where can it be ministry and market at the same place?
But the thing now is, not everybody will agree with you that it's ministry. That third option you brought in. Because sometimes it looks as if it's just a corporate job. Oh, it's just show up, do your work, attend to people, they pay you, you attend to your patients, and you walk away.
Okay, then now we go back to defining what we mean by ministry. Because
Please, sir,
again,
let me hear from you.
there's another assumption that ministry is people wearing suits, wearing tie, with a lot of protocol, with people calling you Papa or Mama or holding a congregation.
I wasn't thinking
That's
that,
what
but
we
okay.
refer to as ministry. Yes.
Mm-hmm.
Yeah, but ministry, at least if I don't have a dictionary, if we're going to go by dictionary definition, it comes from the word to minister. To minister is to minister. It means to attend to somebody's need.
Mm-hmm.
Do you understand? That's you ministering to the person. It's an English word. It's not necessarily a theological word or a theological language and all of that. So if you look at it in that context, why can't it be both? Because I'm administering healthcare to you. So why can't that be a ministry?
But, sir, actually, the thing here, I think, let me tell you what my dictionary says.
Thank
where
you.
Okay, so it is the work of a spiritual or charitable nature.
Work of a spiritual or charitable nature. All
Yes,
right. So there's a charitable part of it.
Exactly.
There's a spiritual, no problem. I hope this is Oxford Advanced Learners Dictionary.
Well, Dr. Van, it's like you bring out your own dictionary. Your dictionary is a dictionary. But that's not the only explanation there. That is one of the explanations.
Yeah.
Right. So that's why I made reference to what, why I read it out to you. But from what we have, from the question that is being asked, are you saying that even people who are not of the same faith with, as Christians, do they also consider medicine ministry.
If you consider the word charity from the root word, from the old English meaning of the word charity, there was no other way to explain selfless service. The word charity has been used as a cliche. Charity really means doing a lot of good and expecting nothing in return.
Okay.
And in truth, as healthcare professionals, if you look at the Hippocratic Oath, nobody can pay you for the value of life. So you are actually doing a lot of good, and not your gratitude, or rather what you get in return, whether it's remuneration or whatsoever you are getting in return, is not matching the value of what you are delivering. There's no price to life. So in a way, to a very large extent, you can look at that as charity. Yeah, you can look at that as charity. And I'm not talking about charity in the I'm not in the cliche way that people have handled the word charity. I'm talking about it as being a selfless love or a selfless service that you are not going to get an equated value for what you have delivered. Think about it in that light.
Well, there's something that we need to start on. First of all,
I agree.
I don't like that you're telling me that there's a third option when you've not exhausted the two options I placed on the table.
Okay, all right. So,
yes,
fair enough.
Good.
Fair enough. All right. So, I'm running away from the temptation of you boxing me into one
I
of the
have
two.
to box it on the front. I'm ready for you today. Today. So, I prepare for you.
Yeah. So, because the tendency is to run into extremes of both. On one hand, the extreme of I like to look at marketplace as where you exchange things of value, where you exchange things of value. Some people have taken it. Some people regard their medical practice as being an avenue or being an opportunity to exchange things of value, and they limit the value to monetary.
Okay, which is true.
Right?
Yes.
So if you look at it in that manner, you can talk about profitable medical practice where the major drive is money. But I am saying that there are still another set of individuals that the value they deliver is not monetary. Okay. The additional value they deliver. So, for example, I'm a Christian. The extra value I'm adding to the person is the love of Christ. I'm saying that beyond the profit of money, that if you accept Jesus as your Lord and Savior and you make lifestyle adjustment, that's a lot of value to me. Yes. So this is me adding, because Jesus will say that you should heap treasures for yourself, so in a place where moth and rat will not eat it up. So exactly. So even me too, I'm getting value, monetary value from it. It's just that the account is somewhere else.
Okay, so just to ask you, there are people who would be on the extreme of either of the two. Because what I want us to talk about a bit more is the extremes of these two. How do we find the balance, right? Between it being a ministry and also being that marketplace.
Okay.
Where we get to, we're generating funds, we're, the whole revolving funds here. So how do we balance it out? All right.
So so if you look at the extreme of ministry, you will, if you take that overbar, you will lose out evidence-based medicine. Yeah. So you have people refusing to go. So you see, science is not against God. If God made the universe and science is finding out whatsoever is in the universe, you should find God in it. Science can never be against God. Science did not invent itself by itself, truly speaking. So in fact, for me, I'm happy being a scientist, because for everywhere I turn to, at least I should see a reflection of God in the science that I practice. Yeah, so the extreme of moving that is, we have the tendency to over spiritualize a lot of things. It limits even medical research when you call everything a spiritual problem. I know there is still that conversation that we should have, that life is spiritual, so every illness comes from a spiritual source. So now we begin to say, how do we now say that we know the risk factors for causing stroke, for example. You understand?
Yeah.
So if you begin to move into a lot of, the in the Nigerian way of ministry, you will. So and I have to use that in parentheses. You will over spiritualize a lot of things. We will lose the beauty of discovery. People do not go to read and study the human body. So you fall short of the advice of Paul to Timothy, that whatsoever you find yourself to do, you do it diligently as unto the Lord. So you lose that part. That's what I think on that extreme. The other extreme now is profits. So how, if everything is money driven, we can begin to sell even our own parents. We're not too far from ritualists that can
Oh
do
my
anything
God.
for money.
True.
Yeah, so that's why I don't want to be labeled. Go in those pathways. But I rather want to see it as that a marketplace is where you exchange values. It's where everybody chooses which value you want to exchange over there.
Okay.
Yeah, you exchange. What do you think? You have been a doctor. You know what the marketplace looks like. You've been to banks. You've been to markets. So
Left for me, I feel just like you said that there's a balance. I feel there's a balance, yeah? There should be a balance
is that
rather.
even supposed to be a balance? Is that not
Yes.
how people are supposed to look at things?
Well, I don't think so. Sorry to disagree. I feel there should be a balance on the two. Because there are chances that if you are just going to be extremely compassionate, extremely religious now, in quotes, the likelihood of you burning out. The likelihood of, just like you mentioned, where, it defeats the aim of seeing God in science.
But whether you do it for profit or not, burnout does not select ministry.
So I think it does.
It's just that
No,
the
I'll-
money in a way.
No, I'll tell you why. If you're doing for the profit, the money is going to come in.
Yep.
And then it erodes. You won't work. You won't give in the extra. You won't be more compassionate.
Are
you
you
just
sure?
yes.
No, you will not be compassionate, but you will run 4-5 places. For the money.
No, I don't think so. Now let me tell you why I said I don't think so. People
Okay.
are just going to, let me just do my bit and go. And they won't take on that extra. Of course, we already know what's happening in the country, that doctors are living in their droves, except I'm getting it wrong here. But doctors are living in their droves. So we get extra work. And so you do some more work, right?
Yeah.
You do extra work.
But you get paid.
But you don't get paid enough.
No, but that's why you are doing the extra work, so it becomes you only give services to the highest bidder. That's what we mean by profit, right?
Yes, but I'm trying to say now that if you're going to do it for the highest bidder,
Exactly. That's profit.
you lose the compassion. It's no more there. You're not doing it out of compassion.
You are doing that of compassion for the
no,
rich. Yes, because even rich people need compassion. Compassion for the rich.
no. See, so now it defeats the aim. It's no longer a ministry. It defeats the aim. It's no longer a ministry per
So
se.
you're saying we cannot administer Jesus to rich people? What do you have against rich people?
I don't have anything against them. I'm just trying to say that I don't think, if it means, it's part of our ethics, right? I'm trying to remember which one of them it is. Oh no, Dr. Wondib, I don't like how you're nodding.
waiting to hear which ethical principle talks about not collecting money.
No, equity. I'm trying to say equity, treating everybody regardless of their social status. That's what I'm referring to. So now,
If they can afford,
whether they can afford it or not.
that's not part of equity.
Oh my God. Dr. Bondi, please wait now. Let me explain what I mean. You're misunderstanding me. But what I want us to know is this: that if you start picking who you want to attend to, especially for the reason, or rather for profit reasons, it defeats the aim of that whole ministry. You're not compassionate enough. You can't be telling me it's because this person is real. In fact, you're doing it because of the money.
Quick question.
Yes, sir. Yes, sir.
Why then do hospitals don't open their doors to everybody? You must pay consultation. Don't you think in a way it's part of selecting those who can afford get access to healthcare?
Not really.
How?
They open their doors to everybody.
If you can afford.
They expect that people can do the best, I mean, that's why they're putting structures into place. You have the NHIS, you have...
If you can afford... Is NHIS free? Are you not
It's
supposed
not
to
free, but it's not...
contribute to the scheme?
But you can't compare the amount they pay to people who pay out of pocket.
But I'm saying that whether you pay out of pocket or not, you are paying something.
Something.
So if you
Yes.
can afford, we go back to the word if you can afford.
Yes, if you can afford. But sir, what I'm
Okay.
just that's where the balance comes in now. Yes, now the balance of you working with compassion, right? And then knowing that the healthcare system needs to be sustained. We can't like if you're just going to do it for the profits, it means I think it makes us more like robots. Get up. We just get up, go to work each day, waiting for the richest person to come and get and attend to them, and we don't attend to people who we feel cannot afford the services anymore. Does it not defeat the aim?
Next question. Investigations. If you cannot afford, do we go ahead and do it for you?
No, we don't.
Thank you. So are we still not doing it for people who can afford?
Yeah. But then again, I think that, there's something that's happening in the hospital currently.
Okay.
But of course, I think people do not appreciate some health workers enough. Now, I said health workers because not only are doctors encouraged to, in fact, that sometimes doctors bring their own money to pay for some of these things. Not just doctors, health workers in general. They can contribute money so that somebody can get something done. Somebody can get an investigation done. Somebody can be attended to. They do that, right? So, what do you have to say about that?
Okay, so okay, nice one.
Dr. Wandi.
I'm trying to
Sir,
know. You see, I'm trying to make you know that you cannot box into two places. You cannot say it's either market or ministry. It has to be both.
Yes.
That if I am going to my own evolution, if I'm going to give out, right? So this is me giving out something of value. And as I said, of value can be money, it can be personal time. It's not necessarily money. There are patients who just need a doctor to just listen to them, talk with them, advise them, make adjustments. If you are going to do that, that is you are exchanging extra value. And what makes it ministry or not ministry is whether you are going to give that extra thing apart from administering the services of medicine.
Exactly, I agree with
on
that.
a fair price. Because the system has to sustain itself and it needs value to be added to it. We either get money from donor agencies or we get money from collective contribution. Collective contribution is the idea behind healthcare financing. That we collect from everybody and you cater for people who have need at some point in time. And so, yes, I still return back to my first point that this has to be both.
Yes.
Because if you have to box yourself to one, you are at risk of entering one.
Yes. I think it's fair that you finally agreed with what I was saying.
I did not agree.
What
What
you did, but it's okay since you don't agree to that. But I know deep down.
One last question.
Dr. Wandi.
You have a patient who can pay you 500k for a 5 minutes review. You have another patient who is an indigent patient that you're supposed to see on the ward. Both of them have the same disease condition. Both of them are in the same state. Who will you see first?
First of all, I'll call my chief, Dr. Wandi. I'll call you on the phone. This is where you come in, sir. I'll pick my phone and call and say, Dr. Wandi, where are you, sir? Okay. That was on a lighter note. But then, I did...
Outro. Not true. I don't agree that ministry has to make you poor. No. That's why I said marketplace is where you exchange things of value. Yeah. So I'm exchanging I'm exchanging medical services. I'm exchanging, ministering the Lord Jesus with the patient. The patient in the other way is exchanging,
true,
not necessarily monetary value. Some of them are exchanging favors. Not favor as in, because no, of course, they are good. I rather use the word they are exchanging goodwill. People exchange goodwill towards you because they think you are competent. They exchange goodwill towards you. They bring opportunities your way because they think you are competent. That's an exchange. That's what marketplace is like.
But my pushback would be that ministry requires extra than just... If you're thinking in terms of ministry, you're thinking beyond just, I'm doing this for money.
Do you get
you need to do
serious
something. There's some
compassion?
extra.
That's what I'm saying.
extra.
That's the only thing you will remove to make it an either or situation is if you are only willing to give medical expertise to the highest bidder. That is it. Because highest bidder will mean that you are only out for the money. Anybody that can afford you is what the person gets. But if you are making consideration to also administer healthcare to people who are not necessarily the highest bidder, you've added compassion to it.
And then, okay, there's also...
Because they cannot pay you back for the value that you are giving.
But sir, even normal, even normal medical services, the money being paid it does not equate it at all. We're
saying that if there's a benchmark, right? If there's a benchmark of services, if you are willing to go lower than that benchmark, it is out of either charity or charity. Now we look at it charity in the sense that we're talking about people who are without, right? But you now talk about compassion if we're not talking about people within or something. But something extra beyond just the monetary value must have pushed you to consider administering healthcare when the person cannot meet a certain benchmark.
Okay.
Either a standard fee charged by the institution or a standard fee charged by the physician himself. So either you might not necessarily be doing it because of, your love for God. Some people are doing it because of love for humanity. Some people are doing it for the love of medicine. Some people are doing it, as extra service. I'm just doing this, to feel good about myself. But one thing or the other, for that particular patient and that healthcare service, you have closed your eyes towards profits.
And but there are some persons who are not closing their eye to that profit.
Now, they are individual. That means they are willing to go for the highest bidder per time. You have sold yourself to a highest bidder per time.
But that's the thing. Why are you now describing it as a selling out?
It's not a selling out.
Because if I'm a carpenter and I tell you I'm doing it for only people that can pay for my services, I
didn't call them a sellout. I'm just saying that they have chosen that way of life. Do you understand? And it comes with consequences. And I'm not talking about eternal
Would you recommend that?
I said, it comes with consequences, and you must be willing to bear the consequences of that pathway. I am not saying this excluding God, eternity, or I'm not even talking about eternal consequences. I'm saying that tomorrow, when you too need help, do not call people in the name of humanity. Because you did not do for humanity in the past. You did it for highest bidder. Your day will come. Everybody's days comes. So the day you need help with anything, we will do highest bidder for you. If you are not the highest bidder, then don't be angry. Life moves on. Yes, life moves on.
There's this other aspect of medicine
an
as
eye
a
for an
ministry.
eye, a tooth for a tooth.
And everybody will go blind.
That was what the cartoon said. And tooth for a tooth.
But there's this aspect to medicine as a ministry where we are going beyond treating the physical body, and we are now thinking about the life of this person, the spiritual aspect of this person, and we're saying, we are now bringing in the eternity conversation.
Exactly.
So
exactly. So now you are now looking at ministry beyond charity. Our dictionary definition says something towards spiritual or charity.
This
so
is spiritual
now you are adding the spiritual component to the dictionary definition. We are Christians. We don't only look at things as charitable for goodwill. We also add goodwill towards God. Yeah, so this is now you adding another extra layer to the value, which is you talking about your spiritual life. This is now you going the extra mile to make sure that as their bodies prosper, their spirit also does prosper. Yes. So tomorrow, out of that same goodwill, either towards God or towards man, will be offered to you.
Clock it.